Good afternoon, and thank you for joining us for today's webinar, Achieving Optimal Wellness, with the Director of MSK's Bendheim Integrative Medicine Center, Dr. Gary Deng. My name is Hannah Belisle, and I'm a member of the Memorial Sloan Kettering Development Team. We're so excited to share today's presentation, the final webinar in our fall series. Today's presentation will be followed by a brief Q&A featuring questions received in advance. After the webinar, this recording, as well as previous ones, will be available for you to revisit and share online. I'm honored to introduce Dr. Deng, a leader in the evolving field of integrative oncology. He has built a robust integrative medicine physician practice and directs clinical services at the Bendheim Center. Dr. Deng is a researcher recognized for innovations in the field and is a principal investigator on projects incorporating acupuncture, yoga, and botanical agents as part of treatment plans. He has also developed integrative medicine education programs for physicians, nurses, acupuncturists, massage therapists, and yoga instructors. He has many publications, including Integrative Oncology Clinical Practice Guidelines, clinical trial data, and textbook chapters. Dr. Deng's approach helps patients through cancer prevention, treatment, and during survivorship. Dr. Deng holds an MD from Beijing Medical University in China and a PhD in microbiology and immunology from University of Miami, Florida. He completed his clinical training at the University of Texas Medical School at Houston and research training at the University of Texas MD Anderson Cancer Center. Dr. Deng is a past president of the Society for Integrative Oncology. Dr. Deng, thank you for speaking with us today. We're so excited to have you.
Thank you, Hannah. I'm really happy to be here to have this opportunity of sharing our work with you and also with the cancer patients community and the general public at large. So the topic we're going to talk about today is about achieving optimal wellness. What do we really mean by optimal wellness and why it is important? So I like to use a case first, which is a very common scenario. And we often see these patients come in, right? A 53-year-old lady with stage 3 breast cancer had all the treatment, initial treatment, and is free of cancer, now on a hormone therapy, aromatase inhibitor. However, the therapy gave her side effects such as fatigue, hot flushes, insomnia, or also made her gain weight. So other than taking the medications, she wants to do more. She asks, what else she can do to deal with the problems, reduce risk of cancer recurrence, and achieve optimal health, and more importantly, thrive in her life. And she doesn't want to just take a medication or a pill for that. So she said, are there other things that I can incorporate into my life to achieve these? And then we said, yes, there are a lot of things you can do for that. And we often use an example of the self-healing capacity of our body. For example, when you cut yourself in the skin, you get a scar, right? The skin will start to heal, and it knows when to heal and also know when to stop. So every cells, every tissue, and every part in our body have this intrinsic ability to heal itself. So oftentimes, after chemotherapy, surgery, radiation, the patient feels like, almost like this tree is deprived of some of the original energy they had, and it's withering away, not thriving, not healthy. On the other hand, what we want to do is make the tree blossoming again, to become really healthy and thriving. So how do we do that? Is there a magic pill we can give to this tree to make them from that not so healthy state to this very healthy, thriving state? No, there's no magic pill for that. What we have to do, and all we have to do, is usually just give the tree what they need. The proper amount of water, the sunshine, sunlight, the right soil, and the right temperature. And when the condition is right, the intrinsic ability of the trees to regenerate, recover, and regrow will come out. And then the tree will start to flourish again. So we can do something similar to our body, which is do everything to strengthen it, give it what it needs, and try to minimize doing things that compromise and undermine it, and don't do anything that hurt it. As long as you do this, your body will just self-recover and achieve the best state it can be. So we call this process healing from the inside out. And we want to harness this ability which resides in each one of us. And we call it taking advantage of the power of the nature. And all you have to do is this more holistic approach to our health, not only to our body, but also to our mind. And this is also relevant in the case of cancer care, because another layer of that, if you look at how cancer cells behave, it's not just the cancer cells themselves are changed. There are mutations, of course, that made them into cancerous. The environment they lived in also plays a role on how they behave. So here's a slide showing the cancer cells and their microenvironments. If you look into the cancer tissues, there, in addition to cancer cells, there are these blood vessels supplying nutrients to them. There's these immune cells trying to attack them but couldn't. And there are all these other supportive cells give them the signal so they can grow or they can mutate or stimulate them. So by changing the environment, we may be able to influence the behavior of these cancer cells. And that comes back to our original thesis, which is if you make the inside of the body as healthy, as strong as possible, you may create an environment that is less friendly to cancer cells, but more hostile to them. And that indirectly will help your cancer treatment. So how do we go about doing these things? This is where the concept of integrative medicine comes in. So what do we mean by integrative medicine? What are we integrating? Over the years, there have been a lot of different definitions, but in the last year or so, a panel of experts working through a very rigorous development process and come up with the current definition of integrative medicine. So here are the key points. Integrative medicine, in this case, when used in cancer care, we call it integrative oncology. Integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and or lifestyle modifications from different traditions alongside conventional cancer treatment. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. So I highlight the keywords in red. First of all, it is cancer patient-centered, because we want to take into consideration what is important to the cancer patients. And also it has to be evidence-informed. There has to be some scientific evidence supporting what we're doing. Maybe they're not definitive evidence because our research is not there yet, but there has to be some evidence. And this evidence has to be used to guide our clinical practice. And the third part is a lot of the things we're doing came from other health practice traditions. But we take those things that has been shown to be helpful and safe and incorporate it into the regular conventional cancer care. This is what we mean by integrating. We don't care where the therapies or the practice coming from. We care about what they can do for our patients. And the last part is integrative medicine put a lot of emphasis on self-care and empower patients to do a lot of things themselves so they can take actions to reduce the risk of cancer and also to recover after cancer, do better during treatment and after treatment. So Sloan Kettering Cancer Center established one of the first integrative medicine program back in 1999. And over time, we have become one of the most well-developed integrative medicine program among the cancer centers in the country. So when patients seek integrative medicine care, what exactly happens? Here's the usual flow of things. So patients come to our service, they usually get a physician's consultation first. We have 4 medical doctors and 1 nurse practitioners providing this service. And here we try to learn our patients as a whole person, not just part of disease processes. We also put them in the context of their life, put their disease in the context of their lives, their physical surrounding, their emotional state, the social environment, and try to identify what's the best way to promote their better outcome. In the consultation, our main job is to inspire and motivate patients. We want to inspire them to show that there's a lot of things they can do that to improve their health, and also we try to motivate them so they can take actions. And then we make specific recommendations on lifestyle changes, because these changes will influence the whole body and the mind. Here, what we do is we empower the patients, tell them what they can do, and also guide them during the process. So if it doesn't work, we make adjustment. If it's working, we encourage them to continue. Things like that. Then for some patients, they may need very specific therapies, which may come from different medical traditions, such as acupuncture, mind-body practice for stress management and to promote better sleep. And here we not only provide the therapies from highly trained, highly qualified practitioners, we also monitor their progress or lack of progress and make adjustment in the treatment plans. So this is what cancer patients will go through when they come to the integrative medicine service. And the specific process is this. The patients see a physician doctor. Sometimes they don't have to see a doctor. If they know what they want, they can just go see the therapist directly. But then we try to design an overall care plan and put on a roadmap so they know what are the areas of deficiencies in their health and what are the things they can do specifically. And we usually start with nutrition counseling, because we know nutrition forms the foundation of our health. Basically, every cell in our body is exposed to what we eat. What we eat can create an environment that discourages cell growth, for example, lowering the growth hormone level or lowering the estrogen or androgen level. Or it can become a stimulating factor. And there have been a lot of studies showing certain kind of cancers, especially the common cancers such as breast cancer, prostate cancer, and colon cancer. There are links between the incidence of this cancer and the people's diet. On the other hand, there are also patients who are interested in this so-called anti-cancer diet, such as the macrobiotic diet, ketogenic diet. Some of them are blown out of proportion in terms of the efficacies. People want to do that hoping to so-called eat the cancer away just by eating the right diet and cure cancer. Unfortunately, no matter how much we wish that can happen, that's not happening. On the other hand, eating healthy definitely helps cancer treatment and help patients recover from treatment and also prevent long-term health problems. So nutrition consultation is a part of what we provide, and we take a more holistic approach and we incorporate some of the traditions from other healthcare practices here. One of the most common areas of question from cancer patients is the use of herbs and dietary supplements. Because on the internet, there's so much information out there, and that you can take this and that, and you may cure the cancer or starve the cancer away. And there's so much information that has become very confusing. On the other hand, we cannot just say, oh, all of them are good or all of them are bad, because each individual dietary supplements have their own effects, side effects, interaction with other drugs or other supplements, and their use has to be tailored specifically for a patient's medical conditions, other disease they have, and also all the other medication they have, so that they can use them safely without exposing themselves to undue harm, meanwhile taking some advantage of some of the benefits that has been supported by scientific research. So guiding the patients in the use of dietary supplements is also a part of what we do. Almost every cancer patient is going through a lot of stress, and actually almost every one of us are going through a lot of stress all the time. So how do we deal with that? We can pop a pill, but it will give you a short relief, and eventually you may become dependent on it. What we are trying to do is to teach patients this ability to manage stress and anxiety by fosters that ability from the inside. And there are a lot of these practices, we call them mind-body practices, to teach us how we can deal with the stress without reacting with negative emotions. And such as mindfulness meditation, yoga, or other guided imagery, there are many different techniques. Which specific practice is good for particular patients depends on the patient's upbringing, cultural background, belief system, personality. So it's hard to say which is good for everybody, but there's a whole panel of these things that patients can try and see which one will be helpful to them. The optimal goal of mind-body practices is that we can harness this ability to deal with stress so we remain at peace, at ease, or better yet, enjoy all the things that life has to us. Then we go to some of the more specific therapies, such as acupuncture. Acupuncture has been used for a long time historically, and it involves the stimulation of body points with needles, sometimes with electric activity or heat. And over the last decades or so, there are a lot of scientific research showing not only the clinical efficacy of acupuncture, especially its efficacy in controlling pain and nausea, vomiting, but also in the neurological mechanism action of acupuncture. Based on this research, a lot of professional societies, such as American College of Physicians, put in their guidelines acupuncture should be considered in the treatment of chronic pain. In our service, acupuncture is used mainly to reduce side effects from chemotherapy treatment or other cancer treatment, such as nausea, vomiting, pain, joint pain related to the use of aromatase inhibitor, and also hot flashes in women cancer patients, dry mouth, and so on. We also conducted many clinical trials showing us how to best use acupuncture for what kind of conditions. Massage therapy is often used to release tension and stress in the body, and also to recover from cancer treatment. These are not just the regular feel-good massage you get from the spa or nail salon. They are therapeutic medical massage. And the therapists are highly trained, and they deal with specific problem as a consequence of cancer treatment. For example, after mastectomy, some patients have a lot of scar tissue formation or cord, and that's the hardening of the myofascia, the connective tissue. And we use massage therapies to loosen up these tissues to improve the range of movement of these patients so they can enjoy life better. Music therapy is another one that we often use, especially in patients with emotional problems or a lot of anxiety, depression, and so on. And we provide this in the inpatient setting, often to patients with advanced disease. Because we all know music can really touch our heart in a very profound and different way that nothing else can do. So it has a very direct connection to our spiritual well-being. And what we do is not only to offer music so patients can listen to it, we also make patients a participant in the making and performance of music. So this is a therapy that also has a lot of research behind it and it's been shown to be very beneficial. Physical activity and exercise, we all know, is very important. And if you look at the research, this is probably one of the things that give you the most benefit in terms of overall health and also as a cancer patient. And what we do is not only the regular aerobic exercise or running on the treadmills and so on, we use some of these practices that not only give you the physical part, but also the mental part, such as yoga or Tai Chi. They're almost as much about mind-body connection than just physical movement. And some of them have a long tradition, but we try to subject them to recent scientific research. For example, we conducted some clinical trials of yoga showing it helps people with chronic dyspnea and also may help people's cognitive function because after yoga practice for a few months, not only they're physically fitter, they're less stressed and they sleep better and their brain has more time to recover, so their cognitive function also improved. When we do these therapies in cancer patients, it is very important to consider safety issues. So a cancer patient with bone metastasis should not just go to the outside yoga studio, any yoga studio, and do a headstand or shoulder stand because they are at risk of injuring their spine. So what we do is we consider patients' particular medical problems, their risks, and offer a plan that is appropriate to them. So these are the specific therapy we offer, but when we tie these two things together, all the things together, how do we look at it at a global view? We see it as what we called 6 pillars for good health, right? So anyone recognize this Roman temple? It's been around for 2,000 years. This is located in Nîmes, the city in southern France. It's one of the most well-preserved Roman temples. If you look at the details, right, they're still the way it was 2,000 years ago. How did they do a good job? Because you take good care of the building. You take good care over the years. So we see our body as a sacred place. We have to have respect to our body, to our health, and we do everything to strengthen it. And the specific thing we do falls into these categories. Eating right, of course, we all know that, but it's hard to do. So how do we do that appropriately is the challenge. And there are a lot of people offer this advice, and we also do our part to design a proper dietary plan for our patients. Exercise regularly. There is a process called autophagy you may never heard about, which means auto means self, phagy means eating, right? So every cells inside, they have the ability to clean themselves, to get rid of damaged part. This process is called autophagy. And the discoverer of this process actually was awarded the Nobel Prize in 2016. And then they find, well, this is very important. It's almost like you have a house cleaner in your house that take off the garbage every day. And every cell, they actually can take off the garbage all the time. How do we strengthen this ability of self-cleansing? And they found exercise is one of the best ways to promote that activity. So in a way, you can think about exercise as a way just to clean your cells out of garbage. So you have to do this every day. It's like you don't leave your garbage in your kitchen every day, right? You have to take them out. And another big part is stress management. And stress is very bad, not only in impacting on our emotional health, it also makes us not sleeping well. And there are even animal data showing stress may make the cancer cells grow faster. There are mice studies showing if you stress the mice for 2 hours a day, there are more angiogenesis. The chronic high level of adrenaline stimulate the growth of blood vessels to support the cancer cells. And this process can be blocked by beta blockers. So there's actually a mechanism of action there showing stress, chronic stress especially, may have a negative impact in the outcome of cancer patients. Right now, we don't have any clinical evidence showing that, but at least the preclinical evidence, the animal study shows this is possible. Every one of us has our own way to deal with stress. Some try to slow down, some try to exercise, some try to have more fun and breathe more and take it easy and meditate and so on. There's no one-size-fits-all stress reduction mechanism, and we just have to find our own way. And we're here to help you find that. This part is actually the most underappreciated, overlooked part of our health, which is sleep. When we are busy, we don't have time. Usually what we do is we cut our sleep time, right? You stay up later. You wake up early by the alarm clock. That's actually very detrimental to our health over the long term in our life. And this is being increasingly appreciated now. So if you look at a lot of these traditional medical system, for example, traditional Chinese medicine system or Ayurvedic medicine or naturopathy from Europe, a lot of them emphasize this circadian rhythm. At what time you wake up, at what time you eat each meal, at what time you go to bed, and you will try to make everyday routine the same to give the body some temporal regularity. And this is called circadian rhythm. And we used to not appreciate this very much. However, the studies and research in the last decade shows this is actually a fundamental part that influences the cellular function of every cell. And there are specific clock genes in every cell. Again, this is being appreciated that the Nobel Prize of Medicine was awarded to people who studied circadian rhythm in 2017, last year. So when we think about it, make sure and ask ourselves, have I had enough sleep today or last night? Was the sleep high quality? Did I wake up feeling refreshed and energized and ready to go? That's what we mean by good sleep. It's not the number of hours you're sleeping, it's the quality and how refreshing the sleep is. The fifth part is something that we often overlook as well, which is the social support system in our environment. I call it the emotional environment. The people in your household, the people in your workplace, are they supportive? Are they nurturing? Or are they draining and exhausting? So we want to nurture the positive relationships and manage the negative relationships. And again, this not only influences how our emotional health is, but also change our physical health. And the last part is what I call the only vitamin that everyone should be taking. I call it vitamin L. L stands for laughter and love. So every one of us, every day, we have to ask ourselves, did I laugh today? Did I have some joy? Did I have some love? Did I receive love or give love today? This is something we have to have every day. And don't forget, a lot of cancer patients, they're always in a defensive mode. They're avoiding this harmful thing, that harmful thing, but they forgot to introduce the positive and helpful things into their life. So give yourself a 1-hour vacation every day. Immerse yourself in things you enjoy doing and get that laughter and get that love and give that love every day. So these 6 parts are what they call the 6 pillars for good health: nutrition, exercise, stress management, sleep and circadian rhythm, social environment, relationships, and also meaning, joy in life. By doing that, we're able to help patients throughout the cancer care continuum. During diagnosis, we try to relieve anxiety and help patients choose the right treatment and steer away from therapies that are promoted as alternative therapies, but they really actually don't do what they say they can do. During treatment, we try to use all measures, including these unconventional therapies that can help patients manage side effects, reduce symptoms, and tolerate treatment better, and get the most out of the cancer treatment. After cancer treatment is finished, we want patients to recover as quickly as possible to regain their functions and regain their emotional health. Because cancer treatment is a very draining, traumatizing experience, and we want people to be back on their feet as fast as possible. A lot of cancer survivors, even after full recovery, they're in this, what I called not sick, but also unwell state, right? If you do all the blood work, everything is normal. If you do the exam, all the scans, everything is normal. There's no specific disease you can put your finger on, but they just don't feel well. They don't have enough energy, they don't enjoy what they do, and they don't sleep well. So all these things are what we call unwell patients. What we're trying to do is focus on those 6 pillars for good health and make them from this not sick, unwell state to the wellness state. And these are what we call sub-healthy patients. So there are a lot of things you can do. And they don't come in the form of a procedure or a drug. It's really about taking care of your body day in, day out, and nurture it and make it thrive. So when patients become well, we want them to be to the next level, which I consider the highest level of health, optimal wellness, optimal health, which is joyful vitality. Not only you're well, you feel well, you also feel a lot of joy in your life. You have a lot of energy. You can do things you enjoy doing that is meaningful to you, and you have this vitality in your life. It's not easy to get through these stages and reach this point, but we can all try, and we are here to help our patients to achieve that. And that is what I see what integrative medicine can offer the most. And we see that as our mission, and to add to cancer patients' care this component so they can achieve optimal wellness. I like to close with a quote from the actor, movie star Michael Douglas. He said, "Cancer did not bring me to my knees, it brought me to my feet." So cancer sometimes is a wake-up call for us to take action, to take better care of ourselves, and put the reset button in our life and start living healthier and better afterwards. Thank you.
Dr. Deng, thank you so much. This has been both informative and inspirational, so we so appreciate you being here with us. During registration, we gave participants the opportunity to ask questions, and fortunately, but also unfortunately, we received more thoughtful responses than we do have time for today. But we are going to get into a few questions. I should say, if you are a current patient at MSK and have additional questions, we ask that you speak with your doctor about making an appointment with the integrative medicine team. I'll jump right in with some of the questions we received. The first is, do you suggest that all cancer patients receive integrative medical care as part of their treatment?
Well, I wouldn't say all should receive, because this is very individualized, but I would definitely say every patient, or even actually every person, should consider and look into it to see what integrative medicine has to offer and whether they can be helpful in your own life, in your own health. And this can be very individualized depending on your problem, medical condition, so on. But definitely keep an open mind and explore these things. But on the other hand, I wouldn't say, oh, everyone should get it, but I think everyone should consider that.
You mentioned this in your talk, but there is so much information available purported to offer expert advice on integrative medicine and cancer. This information ranges from recommended herbs to take away the nausea caused by chemo to potential cures. What sources can patients trust?
The internet. I'm just kidding. Well, the internet is beautiful in that it's give out a lot of information anyone can access, but by this very nature, any information has what I call viral, has legs, it gets spread. And a lot of misinformation gets spread as well. So it is very confusing to cancer patients, and some of these claims are just too good to be true. And unfortunately, those are the statements or news or story that circulate around. So what I would suggest is always use a critical eyes when you read something on the internet or learn something from a brochure or some story from friends and families, and talk to your primary cancer care team and to get their guidance. Sometimes they may not give you the specific guidance themselves, but they usually can refer you to people who are experienced and trained in dealing with these problems. And as far as I know, most cancer centers, even most other medical center hospitals, they have an integrated medicine program, or they have some affiliation or a connection with some community integrated medicine programs or clinicians who are very skilled and do things properly. So my short answer would be to work with your primary oncology team and hopefully access the resource available in these large cancer centers or large hospital system first.
In what ways is MSK unique in its integrative medicine program to improve patient outcomes and experiences?
I think MSK is unique in that it has been taking a leadership role in this whole field. MSK is one of the first cancer centers established an integrated medicine program back in 1999. That's almost 19 years ago. And so we are one of the pioneers in doing this. And part of the reason is because the leadership in MSK, the cancer center, realized it is important not only to treat patients of their disease, but also offer things that improve their overall health and their wellness, as well as improving patients' experience. Because cancer treatment, the journey through cancer treatment is a very difficult journey, and the experience also is important. So over the years, we have developed a very strong research program. We got research funding from the federal government. We conduct clinical trials. So that also makes us unique in that we have a very rich research portfolio, a lot of publications, and contributed to the knowledge base in the field. And the third part that's unique is our service is probably the largest integrated medicine program in cancer centers around the country, and we're led by 4 physicians and 1 nurse practitioners, and the physicians have all been leaders in this field. For example, we all serve at different years president of the professional societies in integrative oncology. And the last part is we do have, in my opinion, better integration of our service with the regular cancer care program. And we're intimately embedded into many services. And we also have probably the highest volume of cancer patients' interactions in the country. Not only that, we try to enhance integration in our own institution. We develop clinical practice guidelines that are evidence-based from systematic review of existing research data. And we develop these guidelines to guide oncologists in the community so that they feel comfortable using certain things and they know what are the risks to avoid when taking advantage of integrative medicine. So this guideline has received good reviews, and the most recent guidelines we participated in developing was endorsed by ASCO, which is American Society of Clinical Oncologists, which is almost every medical oncologist belongs to around the country, authoritative professional organization. They endorse the clinical practice guidelines we develop. What this does is to give the community oncologists a tool, and so that they feel they can incorporate this into their practice and better integrate it. So you can see, our program is unique in that we have always been taking a leadership role and push the envelope and constantly innovate and advance this field, both in providing clinical care, research, and education.
The last question for today. What would you say to those who question the science or are skeptical about integrative medicine in general?
So by its very definition, a lot of these therapies that came from other medical practice or medical traditions is a mixed bag. There are therapies that there's no scientific evidence, there's no clinical evidence. Some of them may even not have a biological plausibilities. On the other hand, there are those that have clinical evidence of benefit, and there is actually a mechanism of action, biological mechanism, and there are lots of research done recently to unveil these things. And the problem is, historically, they're not part of the medical training curriculum. So a lot of the practicing physicians or nurses or other healthcare providers, they're not familiar with them. And they're so busy, they're too busy to keep up with all these new literatures, that's been published every year. So my suggestion is try to learn about them. There are a lot of evidence, and it's just not very widely publicized or widely available. So my suggestion would be to read up on these. At a minimum, maybe look at this clinical practice guideline we developed, because they are a summary of the current state of science. And they're structured in a language that is very practical, so people can use during clinical practice.
Thank you so much, Dr. Deng, for the presentation and for taking the time just to be with us today. And thank you to all of our participants and everyone who's tuned in. We hope you enjoyed the presentation. If you're interested in learning more, we do encourage you to keep an eye out for MSK emails about healthy lifestyles, research breakthroughs, and other topics. You will receive a follow-up email from us that will include today's presentation, as well as a survey about your experience. We encourage you to take the time to give us feedback because it helps us bring you more meaningful content. Thank you again for joining us, and have a wonderful rest of your afternoon.